Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
Our topic today in Neighborhood Health Watch is pelvic floor disorders that too often women don't seek medical care for because they are either embarrassed or might not even know there are treatments to help. Nearly half of all women have bladder control problems, including urinary incontinence, dropped bladders, fecal incontinence, or vaginal prolapse. Now, there are several causes for these problems, and we have a doctor in-house to help women feel a little bit more comfortable talking about it. Dr. Tovia Smith with Henrico Doctors Hospital is joining us. We appreciate it. And this topic is for women and all the men who love them.
Definitely.
You know, exactly. Women are great managers.
All comers.
Exactly.
All comers.
We are great managers of our careers and great managers of families and businesses. But sometimes an issue like this is difficult for a woman to broach with her healthcare provider. Give us some tips on how they might start that conversation.
Definitely. So where I'd start is that, you know, in this busy world of medicine, we have so little time as physicians to bring up every possible issue, especially with your primary care provider. So what I'd tell ladies is just don't be afraid to maybe bring it up yourself if it doesn't come up in screening, as we can't kind of cover everything at every single visit. So number one, don't be fearful or embarrassed if you think you have a problem and want to address it with your physician, and then have your physician send you to someone who feels very comfortable treating these issues.
Now we're talking two issues here. We're talking about vaginal prolapse and also incontinence. Talk about the two, define the two, and what are some of the causes?
Yeah, so pelvic organ prolapse is a condition where one or several organs in the pelvis drop down into the vaginal canal. And many times women don't even know they have this problem. If you do have symptoms, it usually is causes a feel of pressure in the vaginal area or even a painless bulge. So that is prolapse. Incontinence of urine is, it's a common condition, it's not normal, and that is when you have leaking when you don't mean to have leaking and you're not actually on the commode voiding.
So you may not have both.
You may have both, you may have one or the other. These pelvic floor conditions are often found together in the same woman, but are often independent of each other as well, and treatments can be different.
And what are some of the causes? I'm thinking childbirth right off the bat.
Childbirth, number one, simply aging, unfortunately, as well. And then we do think there's a genetic condition as well, a link there, so maybe ask your mother or grandmother if they've suffered from these conditions. And things like chronic conditions, neurologic conditions, diabetes, and smoking.
And what about treatment options, some non-surgical and also surgical?
Yeah, so a lot of women I think initially, oh, this is only fixed by surgery, and that's one of the take-home points today I want to tell you all, is that there are non-surgical and surgical options. So we'll take prolapse to start with. So for prolapse, you can do vaginal exercises to try to bring things back up inside. That's called a Kegel exercise.
Some lifestyle changes.
Exactly, not lifting so much. Something called a pessary, and then there are some surgeries both done vaginally or robotically through minimally invasive techniques.
And very quickly, before we wrap up, any of these conditions life-threatening?
No, another take-home message. These are very bothersome to quality of life, but not typically life-threatening. So please don't fear bringing them up and addressing them with your primary care doctor.
All right, very good information. Thank you, Dr. Smith.
Thank you for having me.
We appreciate it.
I appreciate it.